In this video, I'm going to focus on glottoplasty surgery, and that's the surgery that's commonly done to lift the pitch by shortening the vocal cords. It's sometimes done with laser also to the vocal cords. It's something that's been developing quite a lot recently, and it's helped lots of people. There's a correct way to go about having any voice surgery though, and particularly voice feminization surgery. The findings show that if people start with a low pitch and have a surgery, the voice outcomes are not as good as if someone starts with a gender-neutral type pitch. And obviously in my career, where I've seen hundreds and hundreds of people now, I've seen this happening where people go in with quite a low voice and hope that the pitch surgery will do everything. But what that does, it will only give you a certain amount of pitch increase, so it'll go to a certain level, and it might end up around gender-neutral, which very often isn't the person's goal. So one thing to ask yourself is, if I'm seeking a female perceived voice at the end, my starting pitch has to be at least lifted to a level where that can happen. So for example, if the starting pitch is around 100 Hz or below, it's very unlikely that the gain that you'll make through surgery, which maximally is about 50 Hz, sometimes it can be 60 Hz, but more often than not, it's more like 30 or 40. And so that would take you to a level which is around under 150, and we need a voice for female perception to happen around 155 or above, and many studies say actually at least 160 and above. If you work with a therapist and get a gender neutral type voice, you're actually in the best position for the pitch surgery to be more effective and to get you to the goal that you're seeking. If of course you're seeking a lower pitch and just a gender neutral voice is what you're going for, then it might be okay. But of course it will only work on the pitch. And if the resonance hasn't been balanced pre the surgery, I find that often brings voice problems for people. So there are increasing cases where people need more help post-surgery and end up having a lot more sessions than they'd hoped they'd need because things haven't quite gone to plan. And it's a known trade-off, and every ENT will also let you know that it will cause hoarseness, at least in the short term, and sometimes for longer. So the voice may stay a little husky. So that's another issue to think about. And then it really is a therapeutic route, or the person just lives with a husky voice. And if it's not too compromised, it might be okay for you. But if it is compromised in terms of really struggling to get louder, then that's an issue that's going to need to be resolved with therapy, unless the person just lives with it. So it can happen that somebody just has glottoplasty and no therapeutic input before and after. I can say it's extremely not recommended to do it that way because of what I see with the outcomes if people do take that approach. There will always be some people who have a satisfactory outcome that way, but it will be the minority based on the cases I've seen and what the literature shows. Having a course of therapy first, and then having some rehab for your voice to help the surgical impact that those vocal cords and that larynx has just gone through, and then looking to develop the voice more after that. But at the very least, rehab to make sure the voice settles down and gives you a best chance of having the voice that you'd hoped you'd get for with the surgery. If you found this video helpful, please press the like button and subscribe to the channel.